Go.
Thank you. Thanks, Ollie. And really great pleasure to be here this afternoon and to talk to you around how we've implemented our coaching approaches to primary care general practice. So, as the slide says, I'm Glenn Halliday from LLR ICB. I'm currently the Learning and Change Manager for Work Well, so one of the 15 vanguards across the country. Next slide, please, Ollie. So what I wanted to do today is just to look at how we've approached the challenge and the release of the funding to the ambitions to create this ambition of growing our residents and population. So what we knew we had to fulfill the full delivery plan to support economic inactivity and really support those most areas of need through deprivation, unemployment, and really reach out to the communities through this program. So our vision is to have this program launched within general practice, and what we need to do is to launch that through our primary care networks. So that was the original sort of ask and task set up for myself and the team to do. So that proposed many challenges that many of people on this conference will understand and view, but really it was really establishing the work and health coaches into our care navigation team into general practice, and just really thinking about the additional roles reimbursement scheme with the NHS, and it's such a wide workforce out there, so AHPs, nursing, GPs now. So we really wanted to engage the work and health coaches into that mix. I mean, just for example, health and wellbeing coaches within primary care is really untapped into resource on workforce wise, particularly for us. We've only got 4 whole-time equivalents for that, and we know that some of those roles have moved into the work and health coach role, and similarly with the social prescribers, which is absolutely fantastic, bringing that experience and knowledge into the platform really. So just some geographical update for us is we've got 26 PCNs throughout Leicester, Leicestershire and Rutland. So we've got 22 PCNs that have signed up to the Work Well programme, which is really fantastic for us to really reach out to those deprived areas of need. So we've offered it out to real wide audience. And then what we've done to sort of mitigate that risk of people and the residents not being able to access their particular member GP practice that may not have a Work Well service, we've created a pilot within a pilot, so the roving community Work Well model, which later Paul will speak to really, but Paul's been a real innovator in that pilot there. Next slide, please, Ollie. So engaging general practice, so really new steps to look at that we had to achieve. So we never before we've had to share data from a general practice to ICBs and to DWP. So that was one of the first biggest challenges. A challenge on that basis was primary networks aren't a legal entity, so we had to look to the member practices. So for us, we've got about 132 individual GP practices that we had to reach out to, get the individual signatures to sign up to this new format, a new process. Another big challenge for us was the British Medical Association collective action during the period of time of launch over August throughout Christmas time last year. So that we did pose some challenges on that specific, not to ask any new data sharing agreements, but we did overcome that well. So thank you to the team that are on this call. I'm really looking at capacity on general practice and PCN to take the time and opportunity to look at their capacity. We know that premise is a real challenge for GP practices that have not got space, and where they have space, they do want to fulfill it with clinical workforce. So that was a gap that we need to sort really. And then again, the data sharing agreements. So that transition, collecting the data and look at any gaps. So what we are doing on a weekly, monthly basis is looking at the data, look at any gaps on referrals, etc. Next slide, please, Ollie. So integrating the work and health coaches. So I've already mentioned the additional roles reimbursement scheme. So it's really important for me and the team to introduce the work and health coaches to the current workforce. to let the current workforce know what the changes meant, what the new workforce were doing, how would they would connect with the other social prescribers, care navigators, and how referrals will come in, and any sort of local intelligence about particular clients or patients that social prescribers see that may fully require this kind of personalised support, and really receiving those direct referrals from healthcare professionals, whether it's an advanced nursing practitioner or a physio, to support with the process. And really, with the work and health coaches, it's really important to have a view on the multidisciplinary teams to support that clinical intervention that may be needed as part of their personalised care support plan, whether it's a thrive or a return into work. And really, just mention some partners on there. So Job Centre Plus is a real strength within a partnership for us as a Workwell Vanguard, really looking at the work coaches within the Job Centre Plus site that are signposting into our Workwell service and other NHS service provisions. So example would be mental health, IPS services, and drug and alcohol, etc. And really a big part also is the community side of things, voluntary community sector. So again, that's signposting and referral and signposting into our roving community model. Next slide, please, Ollie. So another really big important thing for me is to set up a community of practice for work and health coaches. Absolutely, work and health coach is a new role for our system, our places. So it really was important for me to have that peer network of support for the coaches, and a really great picture of some of our coaches there and some of our invited speakers to the community of practice. Next slide, please. So the community of practice is really all about strengthening the network, really looking at having a forum to provide an open, safe space to talk about particular challenges, any really showcasing, successes, and really diving deeper into those specific challenges where some holistic expertise may be needed to really highlight the specific need, whether it's pain management and more of the clinical side, and looking at the processes, how we do achieve that clinical support, and really building that confidence and competency within this new role, and widening the growth opportunities that kindly Peak Coaching have offered that through the accredited training programs, which is absolutely brilliant. And then just really to pick out some of the professional engagement we've had on our community practice days. So Job Centre Plus, our disability advisors have come onto the programme to talk, share their experience. A bit of a new area is AHPs within work and health. So we've really tapped into that approach, how we do really support the physios, occupational therapists into this world of work and health, active together. So Active England, and how we support people in the physical activity, adult education. So skills is a really big part of work health and the skills strategy to really enable participants to have the ability to access the skills that are needed to enter the labour market and employment. Talking therapies, MSK is a really big function for a lot of people that are, as was mentioned earlier about the age range of particular people experience MSK conditions, and we've introduced ADHD and autism specialist speakers to come to the group as well, which has been really fantastic. Next slide, please, Ali. So current strategic planning for us, so many of you on the call may know about the FitNote innovation projects that we're currently working on. So really for us, we've got a bit of a systematic problem in the fact of the digital system to certify the second episode of FitNotes, and the GP's time to go through all these 150 per day recertifications is a real issue. So what we're hoping to do is engage our work and health coaches to provide an informed non-clinical view on the participants' ability to potentially return to work on a quicker period of time. We're looking at Workwell 2.0, obviously, as an ICB, where we are clustering with Northamptonshire and just looking at what provisions and pilots Northamptonshire have, and to step in the Workwell 2.0 and into digital pathways. So we've got a really good platform for self-referral, signposting, but it's about how we tap into the digital pathway onto all our service provisions. So Connect to Work, IPS, Connect to Work, SEQF, and then the other IPS services, talking therapies. And again, that access to the adult education and skills. A really big part, obviously, we've now got the medium-term planning that has been introduced over the last couple of weeks. So we're currently looking at how we look at the risk stratification of our workforce in relation to neighbourhood health models and workforce planning, and all in the view to the work and health coaches and other health coaches being a really instrumental part of this prevention side of the 10-year plan. Thanks, Holly, and I think that's my last slide, but really